Good morning, everyone. I'm Dr. Sharon Lewis, the Interim Director of DC Health. Today, we are here at the district's Ward 2 COVID Center to provide a COVID-19 update as we begin in providing both the new bivalent Omicron booster and the flu shot. We want all district residents to know that they can take both shots at once at any one of our city's 8 COVID centers. We're in our 3rd year of living with COVID-19. The good news is things have been getting better because you have continued to be diligent in getting vaccinated and taken the necessary precautions when engaging in indoor activities. Because of that, our case numbers and hospitalizations are down. I want to thank Mayor Bowser for her continued leadership and my team at DC Health for their fantastic work operating the COVID centers. It is remarkable how these sites have made it convenient to get a free COVID vaccine, a COVID test, or mask. And now, it's just as convenient to get your flu shot. With kids back in school and winter just around the corner, we all will be indoors a lot more, which means it will be easier to spread COVID-19 and the flu. We're excited to have a booster shot that was specifically created to combat the Omicron variant that hit us so hard a year ago. I'd like to turn things over to Dr. Farley, the Senior Deputy Director for the Community Health Administration at DC Health, to talk about how important this booster is and how easy it is to get the flu shot right along with your COVID booster to keep yourself and your family healthy through the winter. Dr. Farley.
Thank you very much, Dr. Lewis. Again, I'm Dr. Tom Farley. I'm the Senior Deputy Director for the Community Health Administration, and I'm very excited to be here today. Many of us in DC Health have been waiting for a long time for this day. It's because we believe the bivalent booster, also we may call the Omicron booster, we see as the biggest advance in the fight against COVID since the original vaccine came out in December of 2020. It'll protect people against today's virus variants and save many lives. So let me give you some background on that. The original COVID-19 vaccine was developed to match the original strain of the SARS-CoV-2 virus, which emerged late in the fall of 2019. And that was and has been an excellent vaccine by preventing more than 95% of infections and hospitalizations and deaths from COVID. But that virus emerged almost 3 years ago. And since that time, that virus has changed several times. There was the original strain, then it went through a couple of other changes that didn't have names. Then we had the Delta strain, then the Omicron BA1 strain, and now we're at the Omicron BA4 and BA5 strains. That's what viruses do to evade our body's defenses. With each change, the virus has become more contagious. And with each change, the match between the virus and the vaccine we have has been less exact. So with each change, that original vaccine has become less effective, to the point where we are all now vulnerable to infection again. Now here in DC, about 40% of the people getting infected have had 2 doses of the original vaccine. I want to be clear, the original vaccine is still a very good vaccine. It turns what would otherwise be a severe or even fatal infection into a manageable infection and prevents most hospitalizations and deaths. But it's not excellent against today's strains. So our vaccines need to be updated to match today's strains of the virus. And the bivalent booster is just that. It's an updated version of a safe, tried and true vaccine. It strengthens the body's defenses against the original vaccine and against the BA5 and BA4 variant. Now, this change is similar to what we do by updating the flu vaccines every year to match the flu viruses that change every year. Let me give you another analogy. Just as our computer software has to be updated periodically to protect against the threats from ever-changing computer viruses, our body's immune system needs to be updated periodically to protect against the threats of changing human viruses. So today's bivalent booster is back to being an excellent vaccine that perfectly matches the strains of the virus that are circulating in D.C. today. So who should get this vaccine? Well, everyone over the age of 12, regardless of whether you've already had other boosters, as long as it's been at least 2 months since your last dose of vaccine. Now, when I say everyone, I mean everyone. That's including people who have had COVID infection. And that's because the protection you get from this vaccine is better than the immune protection you get from the infection itself. Now, this vaccine is particularly important for people who are susceptible to serious infections, such as people over the age of 65 and people who have medical conditions like diabetes and heart disease. Now, we recommend also that people get, at the same time as this COVID booster, the annual flu shot to protect against either virus that's likely to circulate this fall and winter. Now, in the future, we hope to see a combined flu-COVID shot that people would be getting probably once a year. And so it's a good time now to start getting into the habit of an annual update for these respiratory virus vaccines. So what is DC Health doing to make it easy for people to get vaccinated? Well, the bivalent booster is going to be available in many places across the city, including pharmacies, including hospitals, outpatient centers, and these COVID service centers, like the one we're standing in today. That's starting today. It's also available for people who are homebound through a home vaccination program. If you want to know more about all the different ways and places people can get vaccinated, just go to coronavirus.dc.gov. We're also going to be encouraging people to take this bivalent booster through messages on television and on social media and on buses and bus stops. So what should people do now? Well, update your body's software. Get the bivalent booster now to protect yourself and your loved ones this fall and winter. And with that, we will be here to answer any of your questions. Yes?
Thank you. Dr. Farley, you mentioned eventually the COVID and the flu vaccine could be combined. Do you expect people to then only need an updated booster annually following this unveiling of the new one?
Yeah, that's my hope. There's many things that we can't predict about this epidemic, but that's my hope and the hope of others, that you'll only need to be updated once a year, and you can be updated with COVID and flu at the same time.
If it's been more than a couple of months since your booster, you should get this one. What about, and that this provides, I guess, more protection than the actual immunity you get from having had it? I guess how long should you wait for, like if you've been infected sometime this year? What's the gap on that?
There's no specific time period that the Centers for Disease Control has set for a gap between when you've had an infection and when you should get this booster. A couple of months, maybe 3 months, but certainly when you're better, and you can get it really any time after that. Excuse me? Yes, the vaccine provides better protection than natural infection. So natural infection does boost your immune system, but it's better to get that vaccine to be safe. Yes.
Just to clarify, it is safe to get the flu vaccine and your COVID booster at the same time?
It is absolutely safe to get the flu vaccine and the COVID booster at the same time. Many of the vaccines that we administer have multiple viruses that they cover in their own right, such as the measles, mumps, and rubella vaccine. That's a vaccine against 3 infections that we give at the same time. We also have lots of experience where people got previous COVID boosters and the flu shot at the same time. So lots of experience. It's absolutely safe and effective to get both vaccines at the same time.
Can I ask, do you have to bring your Vax card with you? In the early days, or we had to have our card with us to get the second shot or get the booster. Do people have to bring their card with them?
I would recommend that people bring their card, but we do have a database, and so if you don't have it, we'll still probably be able to get you vaccinated.
And can you give us any updates on what is our case rate? Have we seen an increase in cases? And you mentioned before the percentage of people who are getting it now who actually did have 2 shots.
Right. The rates of COVID in D.C. right now are falling. Most of the infections are being caused by the BA.5 variant. Hospitalizations are falling and number of deaths is low. That's all good. But we've been with this virus now for almost 3 years. We can expect that there will be future waves of this pandemic. It's not going to end now, which is why it's important now to protect yourself for whatever is going to come in the next few months.
Last question.
Do you expect side effects to be worse if you get both the flu vaccine and COVID vaccine or the updated booster at the same time?
Yeah, some people after a flu vaccine or some people after a COVID vaccine, the next day or so may feel a little under the weather. They may have a low-grade fever. That usually passes quite quickly. Either of those could happen. I wouldn't say it's going to be the majority of people, and I absolutely think it's worth it to be protected.
In a lot of places, I guess, the number of people getting boosted has traditionally been less than you like after initial round of the vaccine. But in your, I guess, opinion or from what you see, is that more about accessibility, which is why you're rolling back this way, or is it just sort of people just don't feel like getting the booster, feel like they don't need it?
People may feel that they don't need it, but people absolutely do need to have this booster. And this booster really is a major advance. This is not the original vaccine. Ever since December of 2019, the virus has been moving ahead of us, but now we actually have a vaccine that matches perfectly the strains that are circulating today. So this is an extremely important booster for people to take. No, we don't think so. DC Health has made lots of steps to make vaccine available. Again, pharmacies throughout the city, these service centers which are easy to come to, regular healthcare providers. So it's easy to get vaccinated now.
Can you update us on monkeypox and the availability of monkeypox vaccine? Will those shots be available in these clinics as well?
Dr. Lewis, do you want to do the monkeypox too?
And thank you for the question. We do have clinics that are available to our district residents where they can receive the monkeypox vaccine. We've also been very successful with our community partners that frequently on the weekend we have pop-up clinics such that people can come and receive the monkeypox vaccine. So it's very available to our district residents. They're separate clinics. Yes, there are separate clinics. So we do ask people to register. However, if someone does walk up, we are willing to give them their vaccine. And as I indicated on the weekend, we have the pop-up clinics where people are able to come unregistered and to receive the vaccine.
Thanks, everyone. That'll be our last question.